I'd like to introduce to you our next speaker, Dr. Liliana Montoya. Dr. Montoya was born in Colombia. She completed her medical school at the University of Caldas in Colombia. In 1994, she came to the United States, and after taking her boards, she continued her studies at the University of Miami, San Juan Medical Center in Puerto Rico, and the University of Connecticut. She graduated as a neurologist from UConn in 2002 and moved to Port Charlotte, where she joined Neurology PA. Since then, she has been building her practice and working with the community. She sees a wide range of neurological disorders, including Parkinson's disease, Alzheimer's disease, and other dementias. Part of her practice is dedicated to research to improve the understanding and management of neurological conditions. Please join me in welcoming Dr. Liliana Montoya as she covers the topic of Parkinson's disease.
Thank you very much. Good morning, everybody. Let me see, I have the clicker here, okay. Let me see how this works. Okay, so today I am very excited about talking about Parkinson's disease. A little bit, okay. So talking about Parkinson's disease is a disease that affects a lot of people. There are a lot of misunderstanding, a lot of problems with the management, and that's what is important to talk about it. Now, let me see. Okay, how do I do this? Okay. Now, the first step in managing the disease is basically understanding the disease so you can understand how the progression happened and being able to improve the symptoms and being able to manage the symptoms in the best possible way. I'm sorry. What is happening here? I'm sorry. Okay. Okay. So it's just with those ones. Okay. Okay. Perfect. Okay. I'm sorry about that. Okay. So basically, what is Parkinson's disease? Parkinson's disease is a degenerative disease of the brain, which means that part of the brain is not working as it's supposed to be, and it continues progressing over time. So that causes disability. It seems to be that there are many possible etiologies for the disease, but it's not really clear which one is affecting everybody. And there is no cure, but the treatment helps to improve the symptoms, and that's the part that is more important. Now, there are a lot of people that have Parkinson's disease. Basically, it's considered that about 60,000 people in the United States is diagnosed with Parkinson's disease every year. And about 10 million people around the world has the disease. There is a little bit more men than women having the disease, 1.5 men for one woman. And there is like a 4% of the patients that can have the disease as early as 50-year-old or less. Now, the disease was initially described by a person that is called James Parkinson's, and that happened in 1817. He called it initially like a shaking palsy, because basically the patient is rigid, but it's also shaking. So that was kind of what he said. Then it was discovered that there were some cells that had some inclusions, and the dopamine cells, the dopamine producing cells in the substantia nigra were basically affected. And that's kind of how they discovered that dopamine was the main factor in Parkinson's disease, the lack of cells producing dopamine. Now, this is the substantia nigra. It's a little point in the brain. It's a very, very small area. And it's very difficult to see in testing. Actually, MRIs or CAT scans don't see it. So that's why it's sometimes difficult to diagnose the disease, because we cannot really have an objective a test to do it. Now, the earliest symptoms of Parkinson's, it seems that it doesn't happen in the brain. The new hypothesis think that the symptoms start actually in the gut, and then they move to the brain. So by the time that the symptoms start, the disease has been going on for a little while. And that's why we don't have anything to prevent the disease, because when the symptoms happen, they are already kind of advanced in certain way. So we don't have at this time any test to predict who is going to get Parkinson's or not. We can just try to kind of treat the symptoms, but there is nothing that we can do to slow the progression or prevent it at this point. What is the life expectancy? That's one question that many patients ask me. So I have Parkinson's disease, now what? How long I'm going to live? Parkinson's per se doesn't kill you. It's not a disease that is fatal. If you have complications for Parkinson's, sometimes falls, sometimes difficulty swallowing that can cause aspiration pneumonia, but in reality, Parkinson's don't affect any organ that is going to kill you per se. So the life expectancy of a person, let's say 60 years old, that is diagnosed with Parkinson's is about 22.3 years. And in 2017, that was basically the life expectancy of anybody else. So it doesn't shorten the life per se, it really kind of is just causing the disability, and that's what is important to make sure that we are treating the symptoms alone, so to give you the best quality of life. Now, what causes the disease? There are some genes that have been associated with Parkinson's, but most people don't have any family history of Parkinson's disease. It just happened just because you were kind of the lucky one sometimes. There are some environmental factors, some herbicides and pesticides that seems to be associated to that, but usually the use of this type of toxics are being prohibited now. And there are kind of other risk factors like smoking that is not very clear why that happens, but seems to be that people who is actively smoking, it has a higher risk of Parkinson's. Now, what are the main symptoms? Number one is tremor. What happens with the tremor? The tremor is basically not any type of tremor. It's a tremor that happens at rest. People kind of is just sitting there and the hand starts shaking. Usually, if you move, the tremor stops for a short period of time, but every time that the hand stays in a position, it starts shaking after that. So that's the main problem. Not everybody that has Parkinson's have tremors. 1/3 of the patients with Parkinson's might have no tremors at all. So sometimes we think because there are no tremors, the person doesn't have Parkinson's. And that's sometimes why it delays the symptoms and the diagnosis. Now, the major symptoms are basically rigidity and akinesia. Akinesia means that there is no movement. The persons with Parkinson's tend to be very rigid. They don't have actually the mobility, the reflexes are very slow. Everything becomes very slow. So the muscles are rigid, and the movement is very slow. Even to answer, there is like a little gap of time for the person to answer. Doesn't answer immediately, just have a little bit of delay there. and there is impaired posture. When they're walking, that rigidity makes the person have problems walking, and that problem walking is basically what causes the problems with the balance and the risk of falls. Now, this is kind of basically a picture of somebody that has Parkinson's. They usually have the flex posture, the stoop posture, the chest a little bit forward. They have the shaking. When they are moving, the hands are usually a little bit bent. They don't swing like everybody else when they are walking. The knees are also a little bit bent, and they have the shuffling gait, or short steps. They kind of very, very short steps. And it's difficult sometimes to start walking, but also at the same time, it's also difficult to stop walking after a while. Now, these are symptoms that the patients have to know. That in general, kind of when you see yourself or somebody in your family or a friend having the symptoms, that's what we have to say. Maybe it's a good idea to check. The tremor is one of them. Small handwriting is kind of basically the size of the letters when you write, it becomes very small. And sometimes it becomes like a line. It's very difficult to read for that reason. It's not shaky, it's just very small. Loss of smell, sometimes that's one of the major symptoms of Parkinson and earliest symptoms of Parkinson's. Trouble speaking, sometimes it's more like a mumble speech, very soft. Trouble moving or walking, what we were talking about, the short steps, no swinging the arms, having problems with the balance. Constipation is very common, but it can also be seen in Parkinson's disease. The facial expression is also one of the major things that we see when the patient comes in. It's basically that lack of expression. The person has the eyes, is not blinking as much. The mouth is a little bit open, and when they are talking, it looks like they are not paying attention when they are. They are kind of just like sitting there staring, and you think that they are not communicating, they are not interested in what you say, but this is only kind of the Parkinson, that mask face that happens. Sometimes there could be dizziness and syncopal episode of fainting, because it can affect also the blood pressure, and stooping or hunching over, kind of that's very typical for the patients of Parkinson's. Now, there are other symptoms that affect the brain, for example. People can have problems with memory. They may have hallucinations. They have anxiety, depression. It can affect the breathing pattern. It's usually not like they have problems with the lungs per se, but when they are going to breathe, they feel like sometimes they are short of breath. There is problems with the muscles. They are kind of hurting and they are weak. The constipation, the eye problems, the eye movements are not very good. Sometimes there is the eyes have problems opening up. There is difficulty swallowing, difficulty with speech. They sweat profusely, and they can have basically the other symptoms that we have talked. What are the stages of Parkinson's? So there is a first stage where the symptoms are very, very minimal. Usually affect just one side first, so there might be a little bit of tremor, a little bit of mask face. There might be some difficulty with walking, but very minimal. It's really not interfering with any activity. It's just something that you really have to look very hard to notice, or the patient notice that there is something different on themselves, but it's kind of difficult for other people to perceive that. There is a second stage when the symptoms start affecting both sides of the body. So yeah, that's a little bit more noticeable. Walking might be a little bit more difficult, but still you can go on your life doing everything that you need to do without any problems. In stage 3, there is loss of balance and a slowness of movements. That is the hallmark. That's the main thing. So when you are moving, is really slow. People notice is that talking is slow, moving is slow, getting dressed is slow, but still you can do things. It just takes a little bit more time. In stage 4 is when you have really more limitations. Then to walk, you need to have a walker, for example, because it's not something that you can just walk independently, and you need assistance for cooking and dressing and doing all your normal activities. Then stage 5 is kind of the latest stage. The person has so much rigidity and much more difficulty that they are not able to even walk. They are basically kind of limited to a wheelchair. It's when more hallucinations, delusions, more cognitive problems happen, and you see all the other non-motor symptoms also, like the constipation is worse, the blood pressure is worse, everything else that is happening is worse. This is something that happens usually very, very late. So this is something that I tell patients, don't worry about this at this time when you are getting the diagnosis, because it might never happen. Not everybody has to get to this point. Now, there are sometimes, like 15% of the patients, they have what we call Parkinsonism. That is something that looks like Parkinson's, but it's not really Parkinson's, and unfortunately doesn't respond to the medications as the normal Parkinson does. So these are like symptoms like a multi-system atrophy. There are kind of, usually it starts people around the 50s. It is affecting the blood pressure, affecting the bladder function, affecting the sweating, much more than really the Parkinson's symptoms. It is more complicated to treat because it has more symptoms and they don't respond to the medications for Parkinson's as well. Progressive supranuclear palsy, patients have, instead of the stoop posture, they have more like a rigid posture, and they may have more problems swallowing and with speech, and that kind of complicates things a little bit more. They usually have more falls, and they may have a shorter lifespan for that reason. CorticoVassal Syndrome is very rare. It affects, usually it starts in one arm or one leg, and then it progresses to the rest of the body. It affects more because it causes more problems, again, with swallowing, more problems with kind of blood pressure, more difficulty walking, more rigidity, and that makes it very difficult. Usually it starts in people that is about 60 years old. But the time that most people have symptoms with Parkinson's, that is around 70 or 80 years old, at that time the symptoms are usually none of these really kind of more severe diseases. Those are more. Now, dementia with Lewy body is something that also can have some Parkinson's symptoms, but it's something that it also is like a combination of Alzheimer's disease with Parkinson's symptoms. Alzheimer's causes memory problems, but it doesn't cause hallucinations or problems walking until it's very late. In the dementia with Lewy body, it actually has memory loss, has difficulty walking, and it has very early hallucinations. Treatment is complicated because sometimes if you treat the Parkinson's symptoms, the hallucinations get worse. So it gets a little bit tricky trying to find the right medications to treat this type of patients. There are medications that can cause Parkinson's symptoms. Many of the psychiatric medications can cause Parkinson's symptoms. So if you can stop those medications, it takes about 6 months to a year, but the symptoms can get better. There are other medications that people don't know much about. Some of the medications for nausea can cause Parkinson's if you take it frequently. Some of the medications for depression or medications for seizures even, or some of the blood pressure medications. So that's important when you are evaluating the patient trying to find out if they are taking any of these medications that might be responsible for the symptoms. Vascular Parkinsonism. Some people have Parkinson's symptoms after having a stroke, particularly if the stroke affected the basal ganglia that is in the middle of the brain. Then in the next year, they may start developing symptoms of Parkinson's. They usually do not respond well to the medication for Parkinson's, so that's what is important to talk about. Now, how is the diagnosis made? Because we saw like that little thing, the substantia nigra is so small, we don't see it in an MRI or a CAT scan. So basically the diagnosis, we rely more on the physical exam, getting the medical history, make sure that you haven't been exposed to anything that could cause Parkinson's, make sure that you don't have a family history, everything. The physical exam, and then we can try some of the medications and see how you respond to the medications. Usually Parkinson's patients, as soon as you give the dopamine, they respond very nice. They kind of have significant improvement of the symptoms, and they can start doing much more activity. Imaging is important to rule out strokes, to rule out a tumor, to rule out kind of other things that could be causing Parkinson's symptoms. So we do MRI or CAT scan in order to do that. There is a test that is a DAT scan, it's a nuclear test that can help to detect problems with dopamine availability, but the problem is that it doesn't tell me if it is Parkinson's or if it is one of the Parkinsonian type of diseases. So sometimes it helps more the physical exam and the response to the medications to try to treat it. No, there was some part that is okay. Okay. There is, in order to treat the patients, I don't know what, basically we have medications. We have the dopamine, that is the gold standard medication, that is the carbidopa, levodopa, it's a combination of both medications. The problem with that is kind of we have to give it quite often. It doesn't last. So once it gets in the system, some of the cells in the brain have to take it, and that's what is difficult to get kind of the medication available all the time. So you have to give it at least 2, 3, 4, even up to 5, 6 times a day. So that's a little bit cumbersome. So that's when we start getting other medications. There are some that look like dopamine and can help for the symptoms. There are some special medications in the levodopa that are lasting a little bit longer, extended release, but still it gives you about 5 hours. And then there are other surgical treatments. There are something when people have to take very often the medications. Sometimes it's better they put like a little tube in the gut, in the bowel, and deliver the medication continuously through a pump. So that's something that is easier to get the medication control all day long without the up and downs. And there is also the DVS, that is like a pacemaker that is placed in the brain. And it helps to control the tremors, and it helps to control sometimes the rigidity and the spasms that are happening and limiting the movement in Parkinson's disease. The most important part in Parkinson's is don't despair. Sometimes at the beginning, people is afraid of the diagnosis. Oh my God, I have this, I'm going to die, I'm going to be in a nursing home in 2 years, this is terrible. That's not what is happening, but because of that misconception, people don't look sometimes for the right alternatives for treatment. We can treat the symptoms, even if we cannot cure the disease, even if we cannot stop the progression. If we treat the symptoms, people can have a life that is full and is quite good. It's going to have all the activities that you need to do and have a normal or almost normal life. So that's what is important to do that. Don't despair, try to get more information and trying to go and look for the right people to get you the medications and manage that. That's very important. The other thing is exercise. That's the only thing that really can prevent progression. People that exercise frequently, they have more, they delay the progression of the disease. Sometimes people that exercise since they are younger, they delay the progression. If they have symptoms of Parkinson, it's much later. And even if you just start exercising when you get the diagnosis, the progression is much slower. So there are programs like a Big and Loud that help a lot to improve the voice, to improve the movement, to have wide movements. Dancing, there are kind of exercises with dancing that it helps for that. Exercises for the coordination. Boxing is something that kind of improve the coordination and improve the symptoms. So we know that people that exercise regularly, they have much better outcome. So when you have the diagnosis, important to kind of take your medications and do everything that is supposed to do, but the exercise is something that people don't do that frequently. Oh, I'm kind of tired, it hurts, my back is giving me trouble, and then people doesn't really have the benefits. When you exercise, the stamina goes up, the back pain goes up, the posture gets better, the tremors get under control, so it is very important, sometimes even more than medication, to do the exercise and keep your mind active. So I don't know if you have any questions, any concerns, anything that you want to hear. Okay, so we have a one-on-one consultation area if somebody has any questions or any concern. Okay, in the hallway, in the back of the room. I will be there, so if there is any questions or anything. So we'll see that. Okay.